Okay, so thank you guys for tuning in. Today we're going to start off this podcast with a moment of silence for a good friend. She was, I'd say, like family to me, and just want to let the family know that my heart goes out to you in this moment. The world lost a great soul, and heaven gained a, an awesome soul as well. So here goes a moment of silence for you, Crystal. We're gonna miss you. But before we get started, make sure to subscribe, give us a thumbs up, and punch that notification bell. Welcome to the Vertex. Yo, what's going on, my warriors? Beautiful Friday night. I hope everybody's doing great out there. And if you're not doing great, it's time to set that gear in your mind to start seeing the world differently and start doing different things that are going to bring to you bigger and better things as well. Well, tonight we have a guest that I think we can all benefit from. So if you're tuning in or if you're watching this later on, it's something that you can really benefit from. We have Dr. Hernandez tonight. He's a chiropractor out of the Upper Valley. And I mean, there's so much that it really intrigues me because, man, I've had a bad back for years now. So without further ado, let me go ahead and bring on Dr. Hernandez.
Hey, how's it going, man?
Hey, how are you doing?
Pretty good, man. Appreciate you having me on.
Thank you. I'm very honored to have you on here tonight, and very humbled. I really appreciate. I know how busy you must get, and I mean one of the main reasons I wanted to bring you on tonight is because I've had a crazy bad back for years now.
Right.
Uh, but before we talk about my back, let's talk a little bit about you. I mean, where did you graduate? Where do you currently work at?
Yeah.
Etc.
So, I mean, I'm a Valley boy. I grew up in Brownsville.
Nice.
Kind of stayed here for some of my college time too, um, and from there I ended up kind of choosing a pathway where not many people know about us. Or if you've heard of a chiropractor, maybe you don't specifically know what we do, or the areas that we focus on. Some people only think we treat the backs. But we do treat pretty much anything with a joint or any kind of area of your body that moves.
Wow.
So I immediately I became really fascinated with the body and biomechanics, daily functions and anatomy. I think everybody kind of has like a hidden love for it, kind of identifying yourself because that's what anatomy is. You're technically using your own brain to study your own brain, which is pretty crazy when you think about
Wow.
it. Yeah, man. But so people like you, I see that and I hear that every day in terms of back pain. And what I like to remind my patients is that although it seems kind of strange, back pain is actually really normal. We have some kind of statistic that says anywhere above 85% of people deal with this
Wow.
at some point in their life. So you're not alone in that battle, man.
Wow. Wow. And so, what do you attribute that? I mean, is there any common that you found common ground on this back pain? Um, is there any common ground besides, let's say, an accident? Is there anything like me? I haven't been on a car accident
Yeah,
or
so
anything like.
so that's something that I see a lot, right? People come to me and they're like, I've never had any kind of issues. Why am I dealing with this? And it's the worst pain I've ever felt. And if you truly felt back pain, like it can become extremely debilitating. It's known as one of the number one reasons that people miss work due to pain, right? But I think the more recent trend that I've been seeing, especially kind of having tough through practicing during the COVID times, right, which we all kind of had to get accustomed to with some differences. Um, and people came in pretty much every day during the pandemic, kind of, or
Wow.
I mean, we're still in the pandemic, but like during the closures, talking about how, you know, they've just completely changed their lifestyle, and now they're dealing with pains that they've never felt before. So somebody who was probably extremely active, every day, kind of doing things, maybe in an office, moving around, changed from one night to the next, basically, and then your body becomes extremely accustomed to just sitting, in awkward positions. Because when you're at home, you get comfortable. It's completely normal. Nobody wants to be all professional at home. It's just not normal for us. So I think that level of inactivity, that change in our society during these last 2 years, it's skyrocketed back pain cases, man. At least that's what I've seen.
I see exactly what you mean. I have this one sofa that and it's just that sofa. I can sit on this chair all day long and I'll be fine. But if I sit on that sofa for a day and I try to work out on my laptop, my back will be killing me. So there's something having to do with my posture or me not being used to being in that position. Now, my story goes back to 2018. That's when, all my life I've been having this little lower back pain, just like little pinches, or I would say like stabs, right? And but this one night, I remember I lay down and I tried to get up, and it's like my body was stiff, like straight. I couldn't. Actually, I was curled, like I couldn't uncurl myself.
Right.
So I tried to get up, and it's like I'm stuck.
Right, man. Yeah, and that's actually extremely common. It sounds weird to say, but people will come to me saying "Hey, man, I get stuck. I try to stand up from a seated position and I get stuck." A lot of times, what we see in the trend that we can kind of attribute that to in terms of when we do examinations with people is usually you can trace it back to some sort of weakness in the body. More so, some of those attachments to the lower back, those erectors become extremely fatigued from inadequate use. A lot of people also like to kind of attribute the fact that when we sit, we compress the spine. So under a tremendous amount of time, let's say you work, 8-hour shift, whatever it might be, in an office chair, and you're just kind of there, on the phone maybe, and over time, this micro trauma in your spine eventually kind of develops into something. So some people kind of talk about it like you can set up a cup under a sink and you'll have a drip, and eventually you'll fill the cup up, right? And then it'll spill. So it doesn't have to happen, from one day to the next. It could be an accumulation of things kind of manifesting, maybe months ahead of what you were actually dealing with, So that's why I always tell people it might not have been something that happened right there and then. Sometimes we can trace things back, So don't always think that it's exactly what you do at a certain time that's kind of limiting you.
I see. Yeah, at that point, I thought I was like going paralyzed or something. I didn't know what to do. Honestly, I had to shed some tears because of how bad it felt. I couldn't move. So I was like immobile, and I like my daughter brought me a little office chair like this one, and I just kind of scooted over onto it, and that's how I got around that night. And then the next day, I ended up going to a chiropractor, and they told me that it was a hip flexor or
Okay.
some sort of that.
Yeah. So, I mean, that's probably something that your body fatigued under one position. Some tendons, some muscles become a little shorter, and it can give you some issues. But I think I want to kind of bring up something that I feel like everybody's at least kind of heard of once or twice, and something that just because you asked me what I see most commonly in the clinic, and I want to say, do you have any experience with a magical word that people use as the sciatica?
Sciatica.
Ever heard of that? So the sciatica, yeah, you ever heard of that?
I mean, it's very common. I mean, I've heard it. I've heard it before. I don't know exactly what it is. If you can explain. I mean, I've heard it too many times. Put it that way.
Right. So everybody kind of has an idea of what sciatica is. Most people have a back pain episode and just kind of attribute it to probably being sciatic related. So when we're talking about sciatica, the sciatic nerve is a collection of several nerve roots in the lower back. It starts at L4, goes down to about S3. Those things kind of conjoin together, if you think about it, kind of come together and create one nerve. As this kind of happens, it gives that nerve several areas where it can be kind of obstructed. So all those nerve roots that come out, they're all levels that can be affected, that can affect the sciatic nerve. So if any of these levels are failing, that's where we can start having some irritation, and you'll feel it in the leg because that's where that nerve eventually goes to. But it doesn't necessarily mean that that's where the pain is. So a lot of times I have people come in and they'll be like, man, my calf hurts, my hamstrings are burning, my butt's burning, do something about it. And a lot of times it seems different to them when I'm addressing their spine instead of, following their glutes and going down the leg. And that's where I kind of have to kind of talk to them about, this might be what you're feeling, but the manifestation of the pain comes from a different part of your body. It's not exactly what's going on. So that's where we start thinking about, herniations, degenerative diseases, um, any kind of issues in the spine in terms of inflammation can give you sciatica. Even some muscular problems can kind of compress the sciatic nerve and kind of give you those symptoms down the leg. So if you're dealing with those kind of things, don't ignore the fact that they probably could be coming from the spine, even if you don't feel it there and you only feel it in the leg. We don't chase those symptoms. We kind of have to think about where they're coming from.
Wow. So sometimes you will feel it somewhere where it's not right. So you'll feel it on your leg, and actually have felt that, on the glutes.
Mm-hmm.
And
Yeah, that's usually where people feel it the most. And the glute is there's a good little passageway there, and the nerve's still fairly thick. It hasn't split because when it gets to the knee, it does split. So that's usually where a lot of people will complain, like, "Hey, my butt just burns, or it hurts to bend forward. I feel it in my glute." All those things, all those things that tension that nerve. If you think about it being like a big rubber band from your skull down to your foot, that's really what it is. So you can feel that tension. And it affects people different ways.
Makes sense. Now I just have to ask this question: what has been like the worst case scenario you've seen in a patient that you've actually been able to see a transformation?
Oh man, that's the beauty of what we do. I think we give people another option, and a lot of times the people that come to us have probably already seen somebody for their pain. Sometimes it's the first time that they're feeling this, and they come directly to us, which is awesome. Sometimes it's kind of like, "Hey, let's see what you guys can do for us." I don't exactly know what you guys do, but I mean, in terms of like a case that I kind of drawn to, I did have this one case. I mean, I had a patient literally get carried in, by two of his family members. His legs were literally dragging on the floor because he could not walk.
Wow.
It actually kind of freaked me out at first. Like he had a white t-shirt on. There was blood on the shirt. I had no clue what was going on. It ended up becoming
blood on the shirt.
Yeah,
wow.
There was blood on the shirt. It looked fairly like a little intimidating, right? I ended up finding out he went to the hospital first. There was some blood from like a badly drawn IV, so he came to us after he went to the hospital because he couldn't get any relief there. I worked on him a little bit. I calmed the muscles down, which usually that's what you feel when you're first dealing with issues in your lower back, the spasm that you can't move, your muscles and everything just kind of grabs you. So we worked that, we calmed some of that down. I had him work some breathing exercises to kind of calm his lower back down.
Wow.
And, I told him, "Hey man, let's see you, in like 2 days, maybe just to see how you're doing, make sure everything's going okay." We kept everything super chill today. And oddly enough, even though I kind of told him, he ended up coming back the next day. And he's like, "Well, man, I don't know what you did," but like, he's like, he was just so thankful, and stuff like that is just so rewarding for a doctor, and you just feel like all that time, all that energy that you put into what you do is finally paying off. And like, that's what really kind of grabs me to my profession, is the fact that you get to see changes in front of you. I get to see my patient through a process and see them get better, which is extremely rewarding. I couldn't think of another kind of way to express, something that draws me more to my job than that.
Wow. So this guy you're talking about, he walks, let me just recap, right? He doesn't walk in there. I was going to say he walks in there. They carry him in there because he can't even stand. And you're able to kind of adjust something where he can't. Did he walk out that day, or was he still carried away, or what was?
Yeah.
Did he get a little better?
Yeah, so he was actually able to start moving around on his own, just by kind of calming those muscles down, kind of just like working on a couple things. So everybody assumes, and one thing that I see is that people come in and they're in extreme pain and they think that I'm going to smash their spine, and they're like, "Oh no, that's not how it works." We don't do the whole TikTok thing where everybody's getting their spine destroyed. Those people probably have no issues, so they're just having fun. But a lot of times in the real life, people are hurt and you can't do those things. So we have a lot of other tools that we have in our kind of in our profession that allows us to work on people even when they're at the point where you can't even twist them because, they'll scream in pain. So just some, we use something called drop tables, which the table kind of falls with us through our adjustment, and it kind of lets us get like specific motion where we need it. We can do like flexion distraction where the table kind of lowers itself, and we can use that to kind of open up that lower back a little bit, relax those muscles. So there's a lot of ways to, handle your first encounter, so you're not always going to get destroyed. If you've never been to a chiropractor, that's not how it works.
Oh, you just answered my next question, because I do see a lot of those chiropractors. All I hear is the crack.
Yeah.
So back to this guy. He goes to the emergency room. That's where he came from, right? Or the hospital? Because
Yeah.
it was back pain. I'm guessing they just like numbed him for a little bit, but they didn't solve the problem.
Yeah.
So was there, what is the difference between like having a back pain and taking medicine, or, going and getting checked by a chiropractor? Because chiropractors are actually overlooked. Like you said earlier, people will actually think, well, chiropractor, that's where you go when you get in a car crash.
Yeah.
Some people will go living a whole life like hunched because they just think, well, this is just the way my body is now. And actually it's not, right? There's certain things that could be adjusted or been told, right? They go to the doctor just says, here, take some muscle relaxers
Yep.
and come see me next week and we'll see how you're doing.
Yeah, and that's usually what I end up seeing. And many people are really good at what they do, but some people are really good at what they focus on. You know what I mean? Like if you have a true issue with your foot, you go to a podiatrist. If
Okay.
you have issues with your teeth, you go to a dentist. You know what I'm saying? So several people specialize on things every day. So I always say this, and at the end of the day, your medical choices are up to you. But if you're dealing with a back pain and you have no clue where to go, my best suggestion is go with somebody who deals with spines every single day. You know what I'm saying?
Makes
Because
sense.
sometimes you go to the hospital and their kind of plan of action for you is going to be a little different. They're going to want to get you out of pain. That is their focus, which is perfect. That's what you want. But you have to understand that all these kind of interventions when it comes to relieving pain don't necessarily cure your spine in terms of what you might be having going on. What they'll probably do is they'll shoot an X-ray, make sure there's nothing fractured. If there's nothing fractured, they'll probably give you some muscle relaxants, like you said. They might even offer you a steroid injection to kind of calm down that inflammation. Um, so that's usually how those steps go. When we go, we'll kind of like your first day, if you will, we'll kind of get you in there. We'll take a history. We'll kind of learn everything about you. From there, I kind of get an idea of what I got to look for. So I start an exam. I do an exam on your spine. I find out where the pain is coming from, what's causing it. If there's neurological issues, I'll check the nerves. I'll check all your reflexes, whatever it might be, impaired, just to make sure there's no kind of like contributions in terms of like a herniation causing too much compression on a nerve or something like that. Which I'm not to say that other medical professionals don't have that kind of training, but they just don't do it every day. You know what I mean?
Makes sense. Now, let me ask you this question. Have you had any patients who go in there under treatment, let's just say under like with painkiller treatments, and they haven't been to a chiropractor before, and they see a chiropractor and they get some kind of relief to where they don't need the medication any longer?
Yeah, and I mean, my goal is never to kind of mess with anybody's kind of prescription. That's not what my goal is. But a lot of times, to be kind of honest with you and to be completely, clear, I've had plenty of patients say that they've, decreased their own kind of, whatever they might be taking. Some of them are just taking kind of over-the-counter medications. Some kind of do the opioid route if it's been prescribed to them. Um, some have done steroid injections. I have patients that come with spinal fusions, all kinds of things on their back that they've dealt with in their past life. And I've seen a significant amount of people actually decrease these um, needs, if you will, for these opiates, because a lot of times what ends up happening, and you don't even realize it, is that when you're taking these things, you're taking them off of dependency. You take it to anticipate pain. So you're like, man, I got to go to work. I know my back's going to hurt. Let me pop a couple of these to make sure I'm not feeling anything. and that's not necessarily how medication is intended to be used. You know what I mean? So that's where we start to see problems start to arise in terms of, are we using these medications correctly, or are we just using them to kind of put a band-aid and shield our eyes from what's going on?
Now I know a lot of surgeries are scheduled. I mean, I've talked to so many people and they tell me, "Yeah, I'm scheduled to get back surgery, back surgery, back surgery." Like, um, is there any sort of back surgery that is there any point where a patient should say, "Hey, before I get my back surgery, I should see a chiropractor," um, or all people who are around under a back surgery? Because like it's gonna come up to a well, it depends. If their spine is totally messed up, then they need it. But is there any kind of surgeries that are might not be needed, that might be fixed other ways, or is it when
So
a doctor recommends a surgery, it's final?
So this is a fairly tough question to answer because, like you said, back pain is very dynamic. So it depends what they're going in for. A lot of times we see people get fusions and these disc replacements, laminectomies, whatever it might be, to kind of remove some sort of impingement. 9 times out of 10, I'd probably say it's usually due to some kind of degeneration or even a herniation. You see a lot of people get those herniated discs kind of worked on. Like you said, they fuse that area to create stability, so there's no movement and there's no excess compression to cause any kind of issues. So with this cycle, I always tell people, if you have a herniation and you're dealing with pain, in my opinion, exhaust your resources. Once you have a spinal fusion, once you do anything to your spine in terms of a surgery, there's no going back for it. You know what I mean? So if you ever go that route in terms of you want to create something, metal plaques inside your spine, you have to realize you will lose movement in that section for the remainder of your life. So this is where I tell people to exhaust their resources. A lot of people don't know that herniations, they can actually fix themselves. Some people think that they'll have them there for the remainder of their life, but your body has a process to actually fix herniations. And we've actually seen, and research has shown, that 90% of herniations are better like from 6 to 8 weeks if you're willing to kind of go through the process. Your body does do a good job of taking care of some of those.
Wow. So in certain, like you said, exhaust your resources. Don't just go in for the surgery. Before you do that,
Yeah.
you can go out and get as many, reach all the resources that you can.
Exactly. And I'm not only talking chiropractic, like I'm talking, some people like to do pain management in terms of, some kind of medication or injection, which is very common. Steroid injections are very common. But you can also do, physical therapy, which is, in my opinion, awesome. Strengthening your spine, strengthening the surrounding structures to help everything move and create stability in your spine is a part of something that I think is crucial if you're dealing with lower back pain.
And what would you say is like? I go back to it. I mean, a common. What is one of the other common things that could happen to a person that are not a car accident? What is like a lifting, jumping, overweight? Is there anything else that can take play into a bad back?
So I get this question a lot. Some people will literally, the first thing that they'll say is, I have back pain, but I already know it's because of my weight.
Hmm.
The truth is, there's just no research that is significant enough for us to truly make that correlation. People have, tested this for years, and there's just never been anything that truly ties those two together. Now, with that being said, a lot of times inactivity leads to obesity, and inactivity can definitely lead to back pain. So that's where I can make that link. But saying that somebody's overweight and has back pain and that's what's causing it would mean that every person overweight in the entire world, is going to
What
have
have?
back pain, which is not necessarily true. I see plenty of people, of all sizes that have and don't have back pain. I see people that have no freaking fat on them. They're extremely fit and they're dealing with back pain. So that's
Wow.
where you have to make that change. It's like, that's not necessarily always going to be an issue. Not to say that having excess weight can cause compression on your spine, which that's an additive, but directly causing your back pain, not always. Not from what we've kind of seen through science.
Makes sense. So I know I've made it all about back because I got a bad back.
Yeah, yeah.
What else is there, that you'd like to talk about today? That
So I think a lot of people are kind of a little confused about what we do. So yes, we love the backs. We focus on the back all day long, but we also treat other things. Shoulders is a big one. People come in with shoulder injuries or shoulder problems all the time. Knees, ankles, hip, like the actual hip. Um, so we can work on those things
Wow.
too. Chiropractors can work on those things, but our main goal, and obviously my main goal, is always to kind of provide something that can give people a way to a better way of life than what they had before. And it kind of sucks in the sense that I see plenty of people with chronic pain, pain that they've dealt with for a long time, truly affecting them. And there's been correlations between chronic pain and even depression.
Wow.
So, and these are the people that I see sometimes extremely addicted to medications to kind of block their pain, which are, like we talked before, they're just taking them to anticipate pain, which, you know, it creates a big issue. And there's just so many side effects to some of the things that they take. And, when it comes to pain, they would rather deal with the side effects of medication than deal with their pain. And a goal for me is always to do what I can to get them, at least if they're at a 10 out of 10 pain, to bring them at least to like a 6. That's still an improvement, a
So
step in
you're
the
saying,
right direction.
like, what you're saying is that a lot of people that take the pain management route via, opioids or other prescription meds become heavily addicted to these things.
Yeah, I mean, opiates, they literally make you feel pleasure. You know what I mean? Which is a decrease of pain. If somebody's depressed, if somebody's dealing with all these issues and intense pain, you give them something that increases that dopamine in your body. How would you not? You know what I'm saying? Like, how would that not draw you into it? I think the
Wow.
problem with this is that, when we think about the way opiates were made and why they're so popular now is because back in the 90s or whatever, when they were first coming out, um, unfortunately, pharmaceutical companies that were kind of mass producing these
Uh huh.
forgot to mention the fact that they're fairly addictive. They just kind
Wow.
of said all the great things about how good they are at blocking
Wow.
pain, but they forgot to leave out the fact that they have some very serious consequences when it comes to long-term use, especially because your body creates dependency, and when you create dependency, that usually means something's going on in your body. Your physiology is completely changed now. That's where that attraction to it comes, where it becomes a need. Not even like oh, I should take a painkiller. Like, I need to take it or I'm gonna be, in a really bad state. So
That's real, like, withdrawals that they're going through now after trying to quit. But
yeah.
they have to
So I
like
mean,
decrease a dose, I'm guessing.
right. So I mean, as you become, let's kind of say, it only takes about a week to become addicted to these things. So
Wow.
as as you begin to take them, your body becomes what we kind of call tolerant, right? So you increase your doses because what was working for you before isn't. So you get a little higher, and then you get a little higher in that dosage, and a little higher in that dosage, and you continue to add on until you find, that point that kind of works for you. And this is where a lot of like overdosing issues can sometimes occur because as that dependency increases, a lot of times what we see is it'll get recognized by a doctor sometimes, and they'll cut that prescription off. So these people kind of go through that go through those symptoms of withdrawal because now they're not being prescribed those things. So that usually leads to one of two things. They either find an alternative route, which is usually, unfortunately, a cheaper drug they can find on the street, which is a lot more dangerous, or
Wow.
they find other ways to get that medication if that's something they're truly addicted to. And this becomes a big issue because what was at one time a normal dose for them can now become deadly if they take it, when their body isn't as tolerant to that as it was, and they take it, and that's when we see a lot of overdoses happen.
Wow. Wow. So it'll go from a little painkiller to being 100% addicted to it, to doing whatever you can for it because your body's craving it or needs it at one point, right? Dependency means they need it, right? Like your body
Exactly.
needs it.
Yeah. Your physiology has changed to the point where you need it to kind of continue on, and it usually is addressed to a suppression of noradrenaline. So what ends up happening is, as this process of addiction is going through, you have repeated decreased blood pressure. Your digestion gets a little worse. That's why a lot of people on these things get constipated. It lowers your breath rate, which that's where we end up seeing that kind of People that are addicted to this and then have that kind of last stretch with it, their breath rate actually gets so low where they end up having, these issues in terms of needing paramedics,
Wow.
But what's interesting to me is that when people think of these things, they usually think about opiates, but your everyday painkillers, man, they're not as good as you might think that they are. You know what I mean? They might help you in terms of creating, an advantage. Let's say you have pain and you just take something really quickly. That's completely fine. But anything that you take that's foreign to your body has some kind of side effect, like acetaminophen, the Tylenol that you probably have in your cabinet right now.
Uh-huh.
If you take it too long and if you're not taking it correctly, you can create liver toxicity and you destroy that thing. You know what I'm saying? So
Wow.
all of these things can affect you in some way. So learning how to control and having the proper prescriptions and the proper kind of plan of action for your back pain is the best way to address these things with your doctor.
Wow.
Yeah, man. It's pretty crazy to think, but in my opinion, when it comes to lower back pain, if you're dealing with lower back pain, or if someone listening right now has an episode of lower back pain, they don't know what to do, and then you're taking medications for it, in my personal opinion, when it comes to narcotics, some of the harder stuff, the morphines, all that things, the oxys, save that for a time with a broken bone, recovering from surgery, something severe, something where you have no choices. But if it's just a little episode of back pain that is going to get a little bit better, I would suggest to not take those. It's just not necessary in my opinion. But that's just kind of what I've seen.
That's great. That's great to know. Yeah, I have been prescribed before. I don't recall what it was, but I didn't take it. I mean, I'm the kind of guy who really doesn't take medicines unless like you said, it's the last resort. I need it. Okay, cool, right? And even with the bad back, like that episode I had, it was like I didn't take the painkillers. Instead, they made me do some kind of stretching and they. I don't know, man. It was some heavy duty stuff they did. But they got to my hip flexor through my stomach. That hurt.
Yeah, that's never a fun time.
No, but I felt better after, man. I walked in there, I couldn't like bend below my knees, like if I was trying to touch my toes.
Right.
But when I walked out of there, I was getting closer to my ankles.
Yeah, so, and that's what I tell people, because that's what you're talking about there is an increase in motion. And when I work with my patients, I always tell them, focus on if that area is moving better after we're done. Don't worry about the pain. That comes from somewhere else. Let's worry about what's going on in that section. How are you moving after your adjustment? How are you moving after the treatment? Because a lot of times that's where the focus is. If something's not moving well, you can't expect for it to biomechanically be able to do what you need it to do. You know what I mean? And that's where we see a lot of issues arise. Or people that have instabilities in their spine at the gym, loading it with all the weight that they have. Their spine's not stable enough to be able to create enough stiffness through their lift, and this is where we see some issues happen.
Now I wonder, like when it comes to the older folks, I mean, especially here, man, they're not really open to options. They just think their doctor's their doctor, and that's their clinic they go to, and the doctor. I'm seeing older folks getting hooked on the medicines that they're given, and they don't even know that they're hooked on them, right? Because they're not open to knowing they're addicted, and but slowly, like you said, it only takes 1 week to get addicted to it. Next thing you know, it's like I'm gonna take two. Just I can't stand my back. I believe sometimes they'll even make up the excuse saying my back hurts so much I can't stand it, just so I can take double of those. These older folks, can they still see a chiropractor?
Oh, absolutely, man. And we have plenty of geriatric patients that come to see us, and a lot of times their issues are a little different. So they're probably dealing with some stenosis. They're probably dealing with spinal degeneration, which it sounds a lot scarier than it actually is. But the degenerative process is completely normal in the spine. I would find it weirder if I took an X-ray of somebody, in their 80s and I saw no degeneration. I'd be like, whoa, what the heck did you do your whole life? I really need to find out so I can do some research, right? Yeah. So that's the way that kind of goes. And I tell people, if you've been told in the past you have degeneration or a degenerative disc is what you usually hear. A lot of people kind of call that as like a compressed disc or a small disc, or I have no disc. It's kind of bone on bone kind of deal. That's what we hear a lot of.
Wow.
We
So,
see that very often, and they benefit a lot from what we do, man.
because I'm guessing, being like when as you begin aging and you get older, you become less active. So I'm sure that activity level, your body feels it, right? And your body begins to change. Is it that activity that causes, like, for the older folks? Because I've seen some older folks who can run miles, you know?
Yeah, so we've actually had more recent research show us that before people used to think, man, I'm not going to run, I'm not going to do heavy weights because it's going to lead to my spine wasting. We've heard that a lot. People say that, oh, it's going to destroy my knees, it's going to do this, it's going to do that. Research is actually showing us the opposite. These people that are working out daily, or at least like a couple times a week, even if it's simple exercise like walking, our body is able to adapt to stressors. So if you use something, your body has an innate way to be able to kind of help that area become a little bit more resilient to doing it more often. So if we see somebody who's a repetitive runner, we can look at their spine on a film and actually notice that they have increased kind of thickness in their spine to protect it a little bit more. Some of these lifters have thicker spines, to help them lift these heavy weights. So a lot of people kind of wonder, how are they lifting 1,000 pounds and not get hurt? When somebody's at the gym lifting like 20 pounds on their back and they blow it out. So it's like, how do they create that? And it's a process over time. Your body can adapt. Your spine adapts to whatever you do. You know what I'm saying?
Wow. So basically, like you said, adapt, or even what's that other word? Like, people go when we went from being monkeys to humans, or what they call, right?
Evolution,
So
yeah.
evolution. So your spine basically evolves,
Yeah, with what
right?
you do,
When
man.
you when you exercise it, or when,
Yeah.
right?
You can actually work out your spine in a sense, right? It's not a muscle, but you can actually wear your spine and create some stiffness and some resiliency in there to help you combat some of these issues. And I always tell my patients this, and I love this saying. It's been um, in our professions for a while, where it says, "Motion is lotion, and rest is rust." You know what I'm saying?
Oh,
So the
wow.
more you move a joint, the more that you have something going. It keeps it nice and lubricated, and you do a lot better, right? As long as you're doing things correctly. And if you keep something rested for too long, you can't expect for it to be great. It gets a little rusty, it gets a little achy, and doesn't move that well. But that's just
So
my opinion on the thing. Exercise is fantastic.
great. So on a daily basis, I mean, what can somebody do to just to, like, let's say, not have to be down when you're 60, to be able to not have a bad back? I mean, of course, without we're not talking about somebody who's already had surgery, or somebody who gets into an accident. Just someone who, like me, that I spend my day on a chair, living what they call like a sediment lifestyle, right? Just working from home,
Right.
sitting on my chair. What can I do, especially now during COVID? A lot of people are doing the same thing. What could they do to prevent these changes, that instead of making their spine better, they're like reversing, or
Right.
reversing evolution or something? I can't explain
Yeah.
it. I'm
Yeah.
sure you
Yeah.
understand.
So I've had people ask me, if can you reverse my degeneration? No, no. Degeneration is a completely normal process the body goes through. So that part you can't get over. But you can kind of dictate, how well your body will move in the rest of your life if you kind of create a positive regimen. And this goes beyond just movement. Your spine it kind of absorbs everything. So like we've seen people with increased degeneration that have issues with smoking cigarettes, that can decrease your disc space because it dehydrates them, Um,
Oh,
so a lot of people don't know this, but our discs in our spine don't have a direct supply for their nutrients. They're kind of like a little sac there that it
on their
only
own.
gets it only gets it through a process called imbibition, which is just a fancy word for motion. So you create that motion through the segment. So if you want to keep your spine nice and healthy, you got to move it. You know what I'm saying? So that's what we kind of attribute that to. So if you
So
learn that your spine doesn't have a way for itself to kind of heal itself, you have to move it to keep it strong. That's what you got to do.
so moving your spine, I mean, that's gonna go on like with, like, stretching, because that's the only way I can picture a spine moving, is when it curves, or because,
Yeah.
like
So
me right now, I'm erect most of the time. I'm straight like this, right?
Yeah.
Most if I stand up, I'm standing up. If I lay down, my back is still in the same position, like
Right.
24/7 basically.
Hmm.
So when you talk about motion in the back, are you talking about like hunching the back, or I mean, what could
I
be?
mean, yeah. So moving it like that can increase the motion in the joints, but you would be surprised how well even walking does to improve, your
Oh,
conditions. Nutrition, what you're putting into your body is what your body will give you as an output. So if you take care of your body's nutrition a bit more frequently, if you're a little bit more conscious about what you eat, you're eating some antioxidants, these things that can help kind of combat problems in terms of pain. That is really a pretty solid way for you to be able to take care of yourself in the long run too. Obviously, you don't want to be eating a bunch of junk food and things that aren't going to benefit your body's kind of aging process. There's a lot of things that can age us quicker. You know what I mean? So if you have the opportunity, not everybody does, but if you have the opportunity to be a little bit more active on a daily basis, I definitely recommend it. It's something that can, really make a difference, especially in the long run. So you might not have pain now. Let's say you're in your 30s or 40s. You might not deal with things. You might have a little twinge, but I guarantee you that little twinge, if it's not addressed later on in life, there's a very high chance that it could become a problem for you. You know what I mean?
makes sense. Makes sense. So definitely, I need to keep the body in motion, right? Basically,
Yeah.
keep the body in motion. Like for example, for me, that what I explained to you with my back, they told me mainly it's from sitting down all day long. They tell me, it's from sitting all day long on your laptop working or whatever, right? Um, I couldn't I couldn't imagine pain so bad could come from sitting down. So that's tough. That is tough. So definitely stay in motion, everybody. Right.
Yeah, so when we talk about sitting down being an issue when you're doing it all day long, we're talking about the compression. So if you have your disc in the middle here and you have like these are your two bones in your spine, the disc goes in the middle. The more that we sit, the higher the compression rate is on those discs. You know what I'm saying?
Mm,
So that's where some of those issues can happen because a lot of people like to use this analogy. It's a little outdated, but for this instance, it'll work, right? So if we think about our discs like a jelly donut, if you squeeze several portions or several parts of that jelly donut, you can knock the jelly out, right? That's what some people kind of like to explain as
oh,
as a herniation. When that jelly spills out, it's almost like a chemical spill on your nerves. It can create immediate pain. It can create like so much inflammation, all these different problems, and that's where you start to have that
wow.
burning pain, and that's why a lot of people love the steroid injections. They're like, man, it helped me right away. It's like what that does is they go into that epidural space, inject it, and they use that steroid to kind of de-inflammate that chemical spill, if you want to kind of wash it out,
Wow.
to kind of help that out. But does it cure your herniation? No, it does not. It just cures that area of kind of inflammation at that moment.
It just brings an ease to it. Okay,
Exactly.
so we have a comment here from Mr.
Sure.
Pedro Torres. He says, I guess he means, can bad posture be avoided? What is a correct posture? Because we go our whole life living thinking, well, I stand good. I stand good. I'm good. It's like, for example, me, like, I just realized it maybe 2 weeks ago when I actually stood up straight and I saw my wife and I was a little bit taller and I'm like, wow, all these freaking years and I've been kind of like slouching my shoulders a little, kind of like just standing a little bit lower. Are we supposed to just take the natural pose that we feel is natural, or is there a certain way to?
I get asked this a lot, man. I get asked about back braces. I get asked about my posture at work. What can I do to improve it? Are you ready for me to blow your mind?
Yeah, let's do it.
There's no such thing as bad posture.
Whoa,
There's no such thing as bad posture. Like there's no
mind
such thing.
blown.
Research time and time again has shown us that there's no such thing as bad posture. Posture is whatever you do with your posture, as long as you change it repetitively and keep your spine moving in different directions. So let's say you were sitting like this all day. As
Uh-huh.
long as after a little while you change it to maybe here, or you extend your spine a little bit more, if you continue to change your positioning, that is actually just as good as you sitting like this all day long. Which really, when you think about it, that doesn't give you any benefits.
Yeah.
Because it's uncomfortable and nobody likes it.
So it goes back to motion, right? So it's like,
Yeah, exactly.
if you're in one position all day long, you have more chances of having some sort of little pinch here or there, versus, you're like this and you give I guess you're letting some of your uh, back rest when,
Yeah,
or some taking turns, right? Alternating.
right. So you're continuing to keep it in motion. You're continuing to challenge it in different positions, which is better than you putting on a back brace and kind of keeping it stiff. It's not necessarily the exact same thing, but when it comes to finding a correct posture for you, if you find something comfortable for you, stick with it. I mean, what do people do when they're sitting like this all day long and they start to feel that little tightness in their mid back? They open up, they extend,
Yeah.
and they give themselves a little rotation. So you're moving your spine. It's craving it. Your innate body is telling you what to do. So
Oh, I see.
you know what I'm saying?
Yeah, one that I had a lot, and it goes back to that same sofa, man. I think that sofas don't like me. So if I do spend my day in that sofa, I end up, I think, because I'm hunching like this I have a laptop on my lap. But then I end up, I started noticing I would do that, like what you just said, like stretch back,
Mhm.
and I'll feel this thing here, dude. Like it was like not a pinch, it was more of a poke.
Yeah,
And then I just kept going and going, and it was like, and
and it would
this
pop.
it would pop, and then it
Yeah,
was gone.
yeah, yeah.
So
So
that what is
So you're feeling some issues with some of the cartilage attachments to that sternum there in the middle. It can
oh,
even
okay.
develop to some people in something that we call costochondritis, which is just an inflammation, irritation, if you will, to some of those attachments. But that pop, that release is pretty much you kind of opening that up. So as your chest is much stronger than a lot of the other muscles around you, right? So your pecs kind of bring you inward. If you're here all day long, it can really influence your spine to kind of bring those ribs forward. So as you
Mm.
open that up, that's what you're doing is you're opening up that back, pop, creating some motion, and you're feeling that pop. I saw a message about scoliosis. We'll talk about scoliosis. Let's see.
Here it is. So Peter says, my ex-wife had scoliosis. Can that be fixed?
So when you're a child, if you have a rapid development of scoliosis, your doctor is going to try everything he can to create an intervention for them to kind of improve it to the best of their ability. There's different kinds of scoliosis. Some of them are completely random. Some of them are due to changes in your spine, like hemivertebrae. Some of them are due to um, changes in terms of maybe even like something, a bony growth in your spine, something like that, that's changing the normal anatomy. But in adults, when your spine is completely fused, we can improve the motion in your spine, but reversing scoliosis is completely impossible. So if anyone ever kind of tells you they can do that, they're probably not as credible as you would want them to be.
That
We
would,
can, yeah.
that would be like going to curandera or something and telling you that we're gonna fix your back. Okay, so basically scoliosis. If anybody tells you it's reversible, it's not. To some extent, there might be some relief, or there's something right that you guys can attempt, but it's not gonna be reversed, right?
Yeah, I see patients with scoliosis every day, and a lot of them even have it and have no clue that they have it. It all depends on what your degree of curvature is. You know what I'm saying? So if you have a big curvature in your spine, obviously you're probably going to have some more health concerns still with that, and some more limitations in motion with that. But some people have minimal ones that hardly affect them at all.
Okay, we have Mr. Matty here saying, I have a herniated disc and my whole right side of my back is tensed up all the time. Sucks. You get used to the pain, but when I lay down and my back decompresses, it really hurts.
Yeah, so when it comes to dealing with discs are mobile just like anything else. So they move with our spine whenever we move our spine. So certain positions can increase your pain. This actually is one of the things that can help a provider or whoever your healthcare professional is identify where it could be. Obviously, there's no way to truly tell unless you get an MRI. But if you know you've had an MRI in the past and you've seen the herniated disc for a fact and you know that it's there and you feel that whole side tensed up, you're probably dealing with that muscle spasm that we're talking about, that limitation of motion that your body does to kind of reduce the motion in that spine to kind of help you not hurt yourself anymore, if you will. You kind of stabilize that area. Like anytime that you hurt yourself, what do? You grab it and you don't want anyone to touch it because your body naturally stabilizes it, right? And for the spine, you can't do that. So that's some of the stuff that kind of comes with that. But if you're
So,
laying down, what's up?
No, okay, now go ahead. Go ahead.
Yeah, so if you're laying down to decompress your spine, um, this is a change for your body. So our body on a daily basis is used to being under the gravitational compression, right? And now you're laying your body down and you're going against gravity. And sometimes these changes can take some time for you to get accustomed to. Sometimes it feels better when you're on your stomach. Sometimes it doesn't. But this is where it kind of becomes, it's a little difficult because I don't exactly know where his herniation is. So giving advice for that is a little challenging. But if you're having back pain, or if you wake up in the morning and you have a disc pain, and you know that those first couple steps are super rough on your back, try staying in bed for a little bit. Get a little extension in your spine while you're laying there. Get your knees, rock them side to side, get a little motion in that spine. Get it ready for your day, if you will, instead of popping right up, getting gravity to smash on your spine, and you have some sciatic issues or something like that. Give it a little bit of a warm up, just like you warm your car up before you go. Same kind of deal.
That sounds painful. Hey, Maddie, if you're watching, how did that happen to you, man? If you can explain that a little bit more. So, is there anything that somebody in that case can do every morning or midday before you go to bed to at
So
least help alleviate?
there's a lot of different approaches to this. Most of the time that you'll find most healthcare providers kind of lean to a method called the Mckenzie Method, which is a series of extension exercises, or pretty much just kind of like bringing your trunk up while you keep your hips flush to the ground. You might want to do this on the floor. It helps a little bit better. Sometimes, especially if you have really soft beds, they can be a little difficult for you to move around. So
Is
if you
that kind
find
of like a push up, but without moving the lower half? Or
exactly. Yes, yes.
okay,
But what I want when people do this, I want those hips to be glued to the ground. I don't want that belt to come up. I want it to be kind of nice and stuck, and then that push, just nice and easy. Work that spine into extension, kind of get it there. You don't have to press through the pain at all. My goal with stuff like this is to just reduce some of those symptoms. You might have a little bit of back pain increase. This is actually called the centralization phenomenon, and it is completely normal. Um, but from what we'll see from then is that it'll start to kind of subside with a little bit of time as you continue to extend your spine. You can release some of that pressure, because usually when stuff herniates in a disc, it goes backwards into the nerves where they sit. So the nerves kind of sit back. And if you think of me like a disc, if I herniate that way and there's a nerve coming right behind there, that's where I kind of create an impingement on a nerve. So when we extend our spine, we do the opposite of those forces of the jelly donut pushing things back. We make them go to the front where there's no nerves, and you can sometimes reduce some pressure.
so get some minor relief, which at some point I'm sure any relief
Oh yeah,
is
if you're
good.
truly dealing with a sciatic pain that's kicking your butt, anything that will help you start walking again is you know, beneficial
Yeah,
for
makes
you.
sense. So Peter says, I'm not sure if this is a good question, but is there any medication that really relieves arthritis pain and knees? I know you cannot prescribe anything or recommend any recommendations. Is there such thing as something that can help arthritis? I mean, is it Peter? Would this be a diagnosed arthritis, or is this just my knees hurt and I think it's arthritis because they hurt when there's a cold front? There's is there anything that can reduce?
Well, when it comes to putting things on your knees or taking medications to relieve your arthritis, it's the same thing. This is where it depends. So there's different types of arthritis. So if you know that you just have osteoarthritis, not the uglier cousin rheumatoid, um, if you have just the osteoarthritis and you know that it's pretty much just a little bit of waste, if you will, some people like to refer to it as that. I don't, but for this purpose, it's fine. Um, a lot of people like to come to me and say, I got nothing between my knees, they're bone on bone, I'm walking like this,
Wow.
right? So um, when you see those things, in terms of medication to release that pain or to relieve that pain, whatever kind of works for you. It's kind of difficult for me to make a suggestion in terms of that, because there's no pain medication that goes directly to that. You know what I'm saying? There's like, unless you get like those like rheumatoid arthritis medications that some people sell. But like a lot of people usually stick away from the pain medications when it comes to the extremities. They usually like to put topical things on there, like the BioFreeze, These lidocaine things that can relieve some pain. Some people benefit in their knees and stuff when they use Voltaren, I believe it's called, because it actually has a little bit of, it actually has medication in the cream itself. So you can find some relief in your arthritis pain, but that's more like a process. You don't put it on just for fun. You're actually doing it as a treatment, and it gives you some guidelines on the box. So that's one way to help yourself. But you got to be a little careful with that because they do have medications. So you have to like limit your drinking. It's a little different. You know what I mean?
Oh, wow. Wow. So yeah, he says this was diagnosed by doctors and MRIs. I hate MRIs.
I think everybody hates MRIs, man, because chances are you're going to see something you don't want to see, even if it's not anything that's like truly. So this is my issue with MRIs because everybody assumes that whatever you see on an MRI has to be what's causing the pain, and that's not true. A lot of times we see physicians take MRIs of lower backs and they'll see a herniation on there and they're like, that's got to be it. Let's go in there and fuse that puppy. And it might not always be it, man.
I believe exactly what you're saying. I had one MRI once and it was because for this shoulder. So I go back, the doctor reads the MRI, and he just says, there's nothing wrong with you, man. It's all in your head. That was like 8 years ago, and it's still, I still feel it. So I guess I need to go get my head fixed or something.
Yeah, I mean, like I said, so if you truly have issues, especially in the extremities are different because they're like, held together by a bunch of tendons, sometimes and ligaments kind of just running through there.
So I got it. Emilio says, sorry for joining late. Do herniated discs self-heal with time?
You would be kind of surprised to know that the bigger the herniation, the more likely they are to heal themselves. It's kind of weird to think, right? You would think the bigger that they are, the more dangerous that they are. The bigger that they are, the more chances of them being kind of symptomatic, but there's a chance that they're going to just kind of explode, if you will, and your body sends those macrophages in there to clean up the area, and technically, yeah, they do heal themselves. That little piece that was herniated ends up just dehydrating, and it kind of just gets eaten up by your body, and over time, those annular tears in your discs start to kind of close like this again, and even though it's a little bit of a soft spot, so it's prone to re-injury, yes, your body can heal itself, actually.
So is this it will heal itself, or it might heal itself?
Yeah, so that's where I was kind of saying that the bigger chance. If you have a tiny one that's like barely poking out, sometimes it's difficult for your body to be able to go and dehydrate that little area that's sticking out because it's just not enough. Sometimes it doesn't even recognize it. A bunch of you probably kind of like watching this have herniations and have no clue that they're there. It is completely normal to have herniations and be completely asymptomatic from them. So just keep that in mind. Not only having a herniation is going to mean you're going to have pain. They're not directly correlated.
Gotcha. So looks like Maddie is responding, but okay. So it's too big to put on here. So let me just read it. I asked him earlier what happened to him, right? So he says, I was carrying a heavy box over my right shoulder, climbing a ladder. I rocked too far back, and my bottom left side went out. But when I had an MRI, it showed the center of my back had a herniated disc. So my lower left side goes out from time to time, but the middle right side hurts all the time. It's pretty crazy and annoying and painful. So yes.
Yeah, that's an unfortunate event, when it comes to kind of where your pain goes, it gives us a better idea of what kind of structures are being compressed. So when it comes to someone like you, it really depends what's being compressed in terms of what you're feeling. So that's where we as doctors get an idea of where the pain is as your clinical presentation changes. So like a very common one is, man, I have pain in my calf, and the outer portion of my foot goes numb. That usually leads me to think, okay, you probably have an issue at a level called S1, which is in the sacrum, or right at the sacrum in L5 of your lower back. And that gives us an idea of where we need to address. So this is how we would kind of address these issues, that I would find out what's being kind of affected and then work in those areas. So when it comes to, different presentations like how he's having and like seeing how he had a trauma, trauma is one of the things that can cause, disc issues. So can aging, so can your genetics. It's been proven that genetics can change your spine's composition as well. So you can't leave that out of the conversation.
So this is a question coming from me. Is a herniated disc an automatic need for some kind of surgery?
Not even close. Um, if you have a herniated disc and it's truly, truly impeding your neurological output, then maybe, right? You know what I'm saying? Sometimes it can be improved, but if you have a nerve that's truly being compressed by a herniation and you're having, difficulty moving that limb, loss of strength, if you're having decreased reflexes, if all these things are kind of adding up to where we know, hey, this is actually a big problem, that's when it becomes, an issue. Something that's a little bit more serious that people don't know about is if you're dealing with disc herniations or if you've had traumas in the past, if you start to kind of lose control of your bowels, whether it be, not being able to go or not being able to like kind of control them, this can attribute some issues as well. So it's a little bit more of a serious problem when we're having these issues, but a lot of times it actually presents with what we call a saddle paresthesia. So if any area that you would touch, if you were sitting on top of a horse, any of that area of your body is numb when you're having these issues, it's probably imperative that you see your doctor. You could be dealing with something a little bit more threatening, if you will. So just kind of an FYI out there for everybody.
Wow.
But not all of them cause pain, no.
I see. Okay, so even if if it's just okay, you have a disc, what is it, a herniated disc, right? So automatically, guys, don't go and under the knife. Don't do that, right? I guess go and get a second opinion before you do that, right? If it's impeding, like you said, a normal day where you can't lift up your arm or your arm falls limb or other circumstances like that, then it's a little bit more serious. Then you should consider. All right. So okay, so here we go. So again, so Maddie responded. I can't see his comment again. It says it also didn't help that the last time I had an X-ray on my back, my spine showed beginning of stages of osteoporosis.
So that's something that, some people will deal with. And if you don't know what osteoporosis is, it pretty much is, to put it simply, it's pretty much just kind of a weakening of your bones. They become a little bit less dense than the normal population. So it gives them a higher incidence of future injury, future fracture, things like that. But when it comes to osteoporosis, when I have a patient that tells me that they're dealing with that or that they've been diagnosed with osteoporosis, low level exercise is crucial because like we were talking about before, exercise actually strengthens your spine a little bit. So if you want to keep some of that density in your spine, keeping it active, keeping yourself moving is an easy way for you to combat that without having to break the wallet, just what is walking, you know what I mean?
Nice.
So I think Emilio had another question here.
Yes, he says, Emilio says, can you talk about degenerative, is that how you pronounce it? Degenerative?
Yeah, degenerative.
Okay. Degenerative discs, and if there's anything you can do, or is it genetics in play without reversal?
So, bottom line, degeneration is not reversible. You can't reverse it. And that's another one like the scoliosis. If you ever go to a healthcare provider that tells you they can reverse your degeneration, they're lying to your face. So just keep that in mind. But when it comes to degenerative discs, there's actually this new study that came out that was kind of trying to attribute the fact that people were saying that your genetics have a big play in if you will have degenerative discs, because some people are older in life and don't have much degeneration. You see very small traces. Some people have degeneration starting, when they're like older 20s, even 30s. So we start seeing some of these changes early on in their spine. And they actually did this study with twins. They found different twins that had two different occupations, because everybody used to say, oh man, my job was destroying my back. It's the reason why I'm so degenerative. And we ended up finding out that, at least during that kind of research that they conducted, that wasn't necessarily the case. So these twins had two different lifestyles. Some of them were, very hard workers in terms of intensive labor. Some of them were a little bit more stationary, just working at a desk. So they kind of put these two things together. They got images of their spine and found out that these twins actually had very similar spinal structures and very similar stages of degeneration. So that kind of led us to the fact that, oh, whoa, maybe there's another kind of attributing factor here. Maybe degeneration has more genetic ties than we originally thought. So this is where things started changing, and that's why I like to say that science is always evolving. We're always trying to either prove something or disprove something. We're always trying to continue moving forward, and different information comes out all the time from these studies that might have started like 20 years ago, but the information is barely coming out. You know what I mean? So there's huge ties, but there's also a lot of social factors that can add to it. So if you're a smoker, if you don't work, like if you don't do any exercise, all those things can add to spinal degeneration. And I won't say speed up the process, but kind of not help your case is a better way to say it.
So you say, this is something that can't be stopped or reversed. Sorry. Is there a way to slow it down?
Moving around.
Motion?
Yeah. So these discs become degenerative, and they kind of start to get a little crushed. And this is where people say, like, I have a bulging disc. So if you think about kind of like a rubber substance in the middle of these two, as I start to compress, you'll start to see it kind of inflate, right? So like when you let a little bit of air out of a tire and you see it kind of form that little kind of that little fat part at the bottom. Right. That can happen to your disc when you're having compression from both sides. So that's where your discs start to become a little bulgy. This is where they become to start a little bit more unstable. So you start to have your spine kind of start to move actually. And this can create some problems as well, because spinal instability, although it's not truly like a pathology that we look at, it is still a big additive to problems. We see a lot of people with spondies, is what we call them, or spondylolysis, which is a break in your spine, which is very common in the lower back. A lot of females at the level of L4 have degenerative spondies, which pretty much just means that the spine got so degenerative at a certain segment that tolerates a lot of our load, that it starts to slip forward, and they get a little bit of an instability there.
Wow. Yeah, so Maddie says, the more I move, the less it hurts.
Yeah, and we see this with people with osteoarthritis in their knees. When you first wake up in the mornings, it is brutal. They feel stiff as a brick, and as you get yourself a little bit more active, it starts to improve. So go figure, right?
That makes sense. So Dr. Hernandez, I know I told you can give me 30 minutes of your life today, and you gave me a whole hour, man. I apologize for going over the time. It sounds like you're really passionate about what you do. Yeah, and I mean, a lot of the viewers were able to actually ask some questions and get some responses, and some will, in the future. I guess I'm going to tag you on this post. That way, if anybody asks anything, and if you have some free time to respond, you can respond.
Yeah, without a doubt. And I just want to reiterate, if anybody's listening right now and you're dealing with an issue with back pain, like I was talking about in the beginning, over 85% of our population deals with back pain at some part of their life. What you're dealing with is very normal. What you're dealing with is very treatable for the most part. And especially if there was no trauma involved and there's just mechanical issues and biomechanical problems in your spine that need to be addressed, most of the time, back pain is very much not a big issue. It's just that a lot of times this pain is very foreign to us. We felt ankle sprains, we felt different issues, but back pain is just so different, and it can sometimes really knock you down. But if you're dealing with it, just take some time, relax yourself. You would be amazed how much not being stressed out about pain can help you out, and find the right person for you. It might not be a chiropractor. It might not be a surgeon either. Some people like doing physical therapy, which I think is awesome. Keeping your body moving, strengthening yourself, like we were talking about before, is really beneficial. So find what works for you, and just go at it, man. Tackle your pain, become resilient, kind of learn the fact that what you're dealing with is something that the person right next to you has probably dealt with. I myself have dealt with issues with lower back pain in the past, and I love to say, thank God right now I'm completely pain-free, and it's really led me to love what I do, man.
Wow. So I have one last question for you, man. One last question. This one has to go for the record, so even if nobody's watching this right now,
Huh?
you guys will see this later on. How, in the Hispanic community, everybody could tell it's gonna get cold because their back hurts, or my knees hurting. How does weather affect? I mean, is this a myth? Can it be busted? Is it more of a actually your back always hurts, but there's some cold weather coming in, or does the cold affect the body? How true is this statement?
I mean, we've known for years that cold can make you a little bit more sensible to pain. So I don't know if you ever played football out when it was cold one day. You get a little bit of a hit, and oh my God, it
Oh,
hurts. So
it stinks. Yeah.
that part can kind of attribute to it a little bit. But people have tried to debunk this in the past, and we actually found out that that pressure change can actually kind of affect some of the receptors in our body to a certain point where they can sense that change, and you feel the differences in your body. So your body does react to your environment around you. You know what I mean? So I wouldn't completely disassociate pain and weather changes because we see it very often. But the true mechanical ways that it happens are still very blurry to most people. Everybody kind of has their own kind of deals. But in my opinion, back in the days when your parents told you they had rheumatoid and everything kind of hurt, right? We see it a lot. So when those cold fronts start coming in and when those winter months start coming in, we start gearing up because we know that those pains got to come on in.
Makes sense, man, because I have a brother out there that's more accurate than the weatherman. So, doctor, I won't take any more of your time. I'm going to put you backstage. If you can just hold back there for 1-2 minutes, and I'm going to get right back with you. And I really appreciate you being on.
No doubt, man.
It's been an
Thanks for having
honor.
me on,
It's been a
bro.
pleasure, and everybody's going to get a kick out of it.
Anytime, man.
You.
Love being here.
Thank you. So, my warriors, there you have it. Dr. Hernandez. If you guys missed asking questions that you wanted to ask, like what was his golf score, go ahead. I'm going to go ahead and tag Dr. Hernandez on here. That way, if you guys have any questions, because this is live. So for everybody watching the recorded version, you'll be able to ask, and perhaps you'll be able to answer any questions you might have. Now, I just want to address something. I did put out a video that was scheduled for Monday, but I made an error. It's actually for Wednesday. So I'm going to go ahead and change that over. Just so you know a little bit about this. It's an artist. This guy has a crazy story because he's actually going to talk about the rise to getting to where he wanted to. And I mean, talk about depression, talk about addiction, talk about overcoming excuses, overcoming everything and becoming an artist who's selling paintings, I would have to say almost on a worldwide level now. So if you guys enjoyed this show, again, sharing is caring. So go ahead and share it, like it, or at least be on my next one. I know I'm dropping one Monday, Wednesday. Next Friday, I'm going to be out of town. I'm still going to try to be on. I hope you all have a fabulous night. It's already nighttime. And if you guys have any other topics you guys want to ever discuss, feel free to inbox me anytime. So without anything else to say, y'all have a great one.